So the first element of the SSKIN pressure ulcer prevention bundle is surface, and that's when we'd like you to consider what equipment you might need to put in place for reducing or relieving pressure for your patient. But that element isn't just about looking at equipment, that's also about, is the equipment functioning? And also you need to make sure that the patient and their family are switched on to how that equipment works, because it may not be in the acute setting, it may actually be in the patient's own home. And obviously the functionality of the equipment is really important. So the second element of the SSKIN bundle is skin, and this is an incredibly important element because you're looking at the state of the skin. Is the skin moist? Is it excoriated? Does the patient have any long-standing skin conditions? So it's all about skin inspection. Also, what we want you to do is manage any skin issues. So make sure there's a management strategy in place to deal with if there's moisture or excoriation or any form of skin disease that's existing. So the third element of the SSKIN bundle is keep moving. And of course, everybody knows this is incredibly crucial in pressure ulcer prevention. And that's about assessing your patient's mobility issues, make sure a mobility assessment has been carried out. And then you are looking to make sure that you have put in place a repositioning schedule. Now, of course, that may be your patient needs frequently moving, or it may be that the patient only needs repositioning every 4 to 6 hours. That has to be clinical judgment at the time of your assessment. Again, this is really important that the patient and their family are involved in this, because often the patient can do much more moving than you actually think they can. So it's important that you have that discussion with them before you put any repositioning schedule in place. To prevent a pressure ulcer is reposition, reposition, reposition. The fourth element of the SSKIN bundle is incontinence and moisture management. Now, not all patients are incontinent, and it may not be that they have incontinent moisture issues, it may actually be that they're sweating. If your patient suddenly develops a urine infection or a chest infection, you may find that their skin becomes much more sweaty than usual. This, of course, can play havoc with the stratum corneum, the top layer, your epidermis, and that's what you don't want to break down. Also in this element, it's really important to think if the patient is in any pain, and you need to be talking to them about what strategies they've had in place before they come into your care. So the final element of the SSKIN bundle is nutrition and hydration. This is really important. You want to be looking at your patient's nutrition status. They should have a MUST score carried out on assessment when they first come into your care, whether that's in the acute setting or whether that's in the residential care nursing home or in the community setting, the patient's own home. You need to be addressing any intake issues if they're not taking enough diet on board or they're not taking enough fluid. Hydration for the skin is incredibly important and is a high risk if you have dehydrated skin that the patient can develop skin breakdown much quicker. You need to also consider in this element of the bundle whether you need to refer on to a dietitian to give you more assistance with the patient's intake. That would be both oral and taking in fluids as well. And it may be they want to supplement the patient's diet.